If you've ever had a headache and wondered, is this a migraine, tension, or sinus? You're not alone. The tricky part is that these can overlap, and the goal here is not to diagnose you. It's to give you practical clues you can notice in real life. Think of it like a simple sorting process. Where is the pain? What does it feel like? And what else shows up with it? Migraine often brings a whole body system feeling, not just head pain. Tension headache tends to feel like pressure or tightness from muscles and stress. Sinus-related headache is usually tied to nasal symptoms and facial pressure. But there are common myths, especially around sinus headaches. In the next few minutes, you'll learn a clear checklist-style way to compare the three. You'll also hear red flags that mean you should get medical help sooner rather than later. Let's start with the fastest first filter: location and quality of pain. Moving to slide 2. First filter: where is the pain and what does it feel like? Migraine pain is often one-sided, but it can switch sides or be on both sides. Many people describe it as throbbing or pulsating, especially when moving. Tension headache is usually on both sides and feels like a tight band, pressure, or a heavy head. It's less pulsy and more squeezed. Sinus-related pain tends to sit in the face, forehead, between the eyes, cheeks, or upper teeth. People often call it pressure, fullness, or a deep ache. Here's a helpful clue. Migraine can feel like it's in the sinuses, even when the sinuses are fine. That's because migraine can activate facial nerves and create pressure sensations. So don't rely on location alone. Use location as your starting point, then confirm with the symptom pattern. Next, let's talk about what makes the pain worse, because that's a strong differentiator. Moving to slide 3. Now ask, what happens when you move? With migraine, routine activity often makes things worse. Walking upstairs, bending, or even normal chores can amplify the pounding. Many people with migraine want to lie still in a dark, quiet place. With tension headache, movement usually doesn't dramatically worsen the pain. You may feel uncomfortable, but you can often keep functioning. With sinus-related headache, bending forward can increase facial pressure, especially if there's congestion. But here's the catch. Bending forward can also worsen migraine for some people, because pressure and blood flow changes can intensify symptoms. So instead of a single movement test, pair it with other signs. Sensitivity to light and sound points more toward migraine. Neck and scalp tightness points more toward tension. Nasal blockage with thick discharge points more toward sinus. Next, we'll cover the extras, the non-head symptoms that often give the clearest answer. Moving to slide 4. The strongest migraine clues are the sensory symptoms. Light sensitivity is classic. Normal indoor light can feel harsh. Sound sensitivity can make everyday noise feel unbearable. Nausea is another major clue, even if you don't vomit. Some people also get smell sensitivity, like perfume suddenly feels intense. Tension headaches usually don't come with nausea or strong light and sound sensitivity. You might feel stressed, tired, or mentally foggy, but it's not the same sensory overload. Sinus-related headache is more about nasal and facial symptoms. Blocked nose, thick mucus, reduced smell, and sometimes a fever with infection. Watery eyes and a runny nose can happen with migraine too, which confuses people. A useful question is, do you feel sick in your head, like your whole nervous system is irritated? That leans migraine. Next, let's break down the sinus question more, because sinus headache is one of the most misunderstood labels. Moving to slide 5. Many headaches people call sinus are actually migraine. Studies have found that a large portion of self-diagnosed sinus headaches meet migraine criteria when evaluated. Why? Migraine can cause facial pressure, watery eyes, and a runny nose through nerve pathways in the face. So what makes a sinus headache more likely? Look for clear signs of sinus inflammation or infection. That includes persistent nasal congestion, thick yellow or green discharge, reduced sense of smell, and pain or pressure that matches the affected sinus areas. Fever can be a clue in infection, though not always present. Also notice duration and context. Sinus issues often follow a cold or allergy flare. Migraine, on the other hand, often comes in episodes with a recognizable pattern, and may be triggered by sleep changes, certain foods, dehydration, or hormonal shifts. The key takeaway is simple. Facial pressure alone does not prove sinus disease. Next, we'll map out tension headaches, what they feel like, and how neck and jaw clues can help. Moving to slide 6. Tension headache is often tied to muscle tension and stress physiology, but it's not just stress. The pain is usually steady, dull, and pressing. People describe a tight band around the forehead, pressure at the temples, or a heavy feeling at the back of the head. A big clue is neck, shoulder, and scalp tenderness. If you press along the muscles at the base of the skull or the upper shoulders and it feels sore, that supports a tension pattern. Jaw clenching and teeth grinding can also contribute, especially if you wake up with a headache. Tension headache typically doesn't come with strong nausea or intense light and sound sensitivity. You may still prefer quiet, but it's not the same sensory attack feeling. Another clue is function. Many people can keep working, even if they feel miserable. Next, let's talk about migraine patterns more deeply, including aura and the phases that happen before and after the pain. Moving to slide 7. Migraine is more than a bad headache. It's a neurological event that can have phases. Some people notice a prodrome hours before, yawning, mood changes, food cravings, or feeling unusually tired. Then the head pain may start, often with throbbing and sensitivity to light, sound, or movement. Nausea is common, and some people get dizziness or a sense of imbalance. Aura is a specific set of neurological symptoms that can happen before or during migraine. The classic aura is visual: zigzag lines, shimmering spots, or missing areas in vision. But aura can also be tingling, speech difficulty, or a strange sense of disconnection. Not everyone gets aura, and not every aura is migraine, which is why it's important to discuss new neurological symptoms with a clinician. After the pain, many people feel a hangover phase, foggy, drained, and sensitive. Next, we'll compare timing and duration, because the clock can also give you useful clues. Moving to slide 8. Timing matters. Migraine attacks often last hours to a couple of days if untreated, and they tend to come in episodes with a repeatable pattern. Many people can point to a familiar sequence: warning signs, then pain, then recovery. Tension headaches can be shorter, but they can also linger in a low-grade way for much of the day, especially during periods of ongoing stress or poor ergonomics. Sinus-related headaches often track with the sinus problem itself. If congestion and facial pressure build over days with a cold, and the headache matches that timeline, sinus becomes more plausible. Another timing clue is morning versus afternoon. Waking with a headache can suggest jaw clenching, sleep problems, or dehydration, but it can also happen with migraine. Headaches that build as the day goes on can fit tension patterns related to posture and screen work, though migraine can also be triggered by fatigue. So again, timing is supportive, not definitive. Next, let's talk triggers and context. What was happening in your body before the headache started? Moving to slide 9. Context is often the missing piece. Migraine triggers vary, but common ones include irregular sleep, dehydration, skipping meals, alcohol, certain foods, strong smells, weather changes, and hormonal shifts. Stress can trigger migraine too, but it's often the letdown after stress that sets it off. Tension headaches are frequently linked to sustained muscle load, long hours at a desk, driving, clenching the jaw, or emotional stress that keeps your shoulders tight. For sinus-related headache, the context is usually nasal, seasonal allergies, a recent upper respiratory infection, or ongoing congestion. Another context clue is what helps. Migraine sufferers often seek darkness, stillness, and quiet. Tension headache sufferers often feel drawn to stretching, massage, or heat on the neck, because muscle tenderness is part of the picture. With sinus issues, people often notice pressure changes with congestion patterns. A practical tool here is a simple headache log, not a novel, just time, symptoms, and what was going on. Next, I'll give you a quick compare and contrast checklist you can run through in under a minute. Moving to slide 10. Here's a fast checklist you can use the next time a headache hits. First, ask, do I have nausea or strong light and sound sensitivity? If yes, migraine moves up the list. Second, is the pain band-like, both sides, with neck or scalp tenderness? That supports tension. Third, do I have true nasal congestion with thick discharge, reduced smell, and facial pressure that matches a cold or allergy flare? That supports sinus involvement. Fourth, Does normal movement like stairs make it significantly worse? That supports migraine more than tension. Fifth, do I have neurological symptoms like visual changes or tingling? That can happen with migraine aura, but new or unusual symptoms deserve medical evaluation. The point of this checklist is not to label yourself, it's to communicate clearly. When you can say, I had one-sided throbbing pain with nausea and light sensitivity, you give a clinician much more to work with than a bad headache. Next, let's cover overlap, because mixed patterns are common, and that's where people get stuck. Moving to slide 11. Real life is messy, and headaches don't always fit neatly into one box. You can have migraine with prominent neck pain, which makes it feel like tension. You can have a cold and still get a migraine on top of it, which makes it feel like sinus. You can also have more than one headache type at different times of the month or year. That's why pattern recognition over multiple episodes is more reliable than a single event. A helpful approach is to separate core features from extras. For migraine, the core features are sensory sensitivity, nausea, and activity worsening. For tension, the core is pressing pain with muscle tenderness and fewer sensory symptoms. For sinus, the core is nasal inflammation symptoms that track with infection or allergies. If you keep noticing the same core set, you're building a useful story. And that story is what helps with appropriate evaluation. Next, we'll talk about red flags, headache features that should prompt urgent medical attention regardless of type. Moving to slide 12. Some headaches should not be watched and waited on. Seek urgent medical care for a sudden severe thunderclap headache that peaks within minutes. Get checked if you have a new headache with weakness, confusion, fainting, seizure, or trouble speaking. New vision loss, a stiff neck with fever, or a headache after head injury also deserves prompt evaluation. Another red flag is a major change in your usual pattern, different intensity, different symptoms, or a headache that keeps getting worse over days. If you're over 50 and develop a new type of headache, that's also worth discussing quickly. And if you're pregnant or postpartum, new or severe headaches should be evaluated because the risk profile changes. These red flags don't mean something dangerous is definitely happening. They mean it's important not to assume it's just migraine or just sinus. Next, let's wrap with how to talk about your headache clearly so you can get better help and avoid confusion. Moving to slide 13. If you want a practical takeaway, it's this. Describe your headache like a clinician thinks. Start with location and quality. Throbbing, pressure, stabbing, one side or both. Then add the top associated symptoms: nausea, light sensitivity, sound sensitivity, congestion, thick discharge, fever, neck tenderness. Next, include timing. How fast it started, how long it lasted, and whether it comes in episodes. Finally, add context: sleep, meals, stress load, illness, allergies, and any clear triggers you noticed. That simple structure makes your story clear, even if you're not sure what type it is, and it helps you notice your own patterns over time. If you want, write down the 60-second checklist from earlier and use it for the next 3 headaches. You'll learn a lot just from that. If you found this helpful, subscribe for more clear, evidence-based health explanations, and comment with a forced choice. Which do you get more often? A, migraine-like symptoms, or B, tension-like pressure? This information is not a substitute for medical advice.